afe na me hu afe fel.
Obanyo set reminder your phone no. Ni ba wa bo no kai be na ke haboe. Allo obanyo ke calendar peto free j. No mark be na ke habo akeke gbeken by vaccination.
Osusu mo ene ho hiwa de enche. Keje nwene ke ya wo ba kwe ni be ni atowo. Wo ke tuni.
Esake ohia ka be ni sani obi ya bu vaccine no. Oke ohi wale kwelo awie. Ni okwa ke obi bu vaccine benisa. Boni afeni ebo ame banke je hila isoto yi. Ni vaccine banye esra.
Agaficha aneje Ministry of Health, Ghana Health Service, Kame Waloi.
Vaccinations no ase ebi wo ho a mo anwo
minimpa so adwuma semine akonya beinti aya na ma adwun kwafi e dey wo say ye be wo vaccine no
e ho hia ye pa se obedi emra e dey ahye wo say obewo oba no panye no so se eba se wentimi ambewo e da e dey ahye wo na e ma ne hawo kra obetimi di na bada foforo enti wo de bomodian se obeba da ye hye wo no e na kakra bi pa ho po a enye hwe
e asodie se je be hwe se ye ma no benyini na mo hu so asaye fefefe
obetimi ye use app e wo phone so opekra obetimi the calendar above fridge ho na wa mark data esese mobile immunization
we die e ya adwen papa efie na ekoyi die me hyebo se ye bedi ye mrese se de se
ehun obehia yie pa se obedi mra ye de be hyew se esese wo oba no pane so eno obebo oba na pomudin ene ne yie yo hyene nso se wantumi anko wo oba no pane e bra ye de hyew no a etwemu kakra kra obetumi de oba na ko woni wa pomudin adwuma efo ni nkomo na wo mo ahwe se oba no be wo ne vaccine abra esem na bo oba no ban efi yare ahodo ho. Kasibwe, Ministry of Health, Ghana Health Service, anyone partners, and bro.
Attention parents and caregivers, did you know that measles and rubella are highly contagious diseases that can be prevented with a simple vaccination, and that vitamin A is essential for your child's growth, immune system and overall well-being? That is why the Ghana Health Service is organizing a nationwide measles, rubella and vitamin A campaign from the 2nd to the 6th of October 2024 to protect our children under 5 years old from measles, rubella and vitamin A deficiency. This is your chance to ensure a healthy start and a brighter future for your little ones. Services provided in the vaccination will include measles rubella vaccination for children between 9 months to 5 years and vitamin A supplementation for children from 9 months to 5 years. The vaccination and the vitamin A will be available at health centers, schools, markets, bar stations, churches, mosques, and within communities across the country. No one should be left out because it is free. So join us in keeping our children safe and healthy. Remember, from October 2nd to 6th, and it is free. Let's bring our children to benefit from the vitamin A and measles rubella campaign for a brighter tomorrow and good life. Live it well. This is brought to you by the Ghana Health Service and its partners.
Has lost weight, oh.
But I feed him every day, oh.
Have you been taking him for weighing?
It is very important to track your son Kumi's growth, oh, to ensure he's developing properly. Then I will take him to the clinic tomorrow.
That is why for me, after exclusively breastfeeding my baby for 6 months, I introduced other foods. This helps to provide all the necessary nutrients. It is important to be taking your son Kumi for weighing,
where they teach you the kinds of foods to promote your baby's growth and development.
They will even teach you how to always wash your hands before handling your baby to prevent the spread of germs and to get your child vaccinated against diseases.
Good morning, mothers. I am proud of you for discussing vaccination and the growth and development of our children. You can also get your COVID-19 vaccine if you didn't take it during pregnancy.
Next time when I go for weighing, I will go with my husband so that both of us can take the COVID-19 vaccination.
It is important to pay attention to your child's health, growth and development. Attend weighing regularly.
This message is brought to you by the Ministry of Health, Ghana Health Service, and partners.
Oh, na, obile taloe.
Shida na ihale ni huwe.
Ani okelete wen ye clinic e. Hiawa ake obakwa obi ni he waleke edale ojogba.
Be wo makweni nkala ya clinic e. No hani miele ife exclusive breastfeeding 6 months. Nimbo ele ni konko me hamo ke fata fofo ni nke han lehi. No he wani na nutrients ni he hia fe.
Hia ko ke ni ba ya wen. Ye jeme aba chobo ni strot we ni ba wa he waleke edale ojogba.
Ame ba chobo bo no ba fe no ba forward ni sadane. Then you ba mobile mi no ba mobile banke je mo wa ni ba nya gbe na e ko hu e ame ba cho bobo ni o ba go bile chofa ni ba boy he banke je hilaji ahe
Mimi e shami hi ake ye so vaccination ke wo bi adale ka me he wale na mo hi nke ko ba shi no ake be me ni onye ogbu COVID-19 vaccine ye ho hia mo bia me ye fo mo se o ba nya ogbu
ayi bala don exem ke le ba ya. We nyo we ya vaccine.
Here wa ake okwe obi adale ke hiwale ojugba. Yawe yimbe fe beni ahabo ake oya.
Agafi Chaneje, Ministry of Health, Ghana Health Service, Game Walloy.
Na ubei asani so ati o.
Na so me aduane da bia o.
Na ya wodi ne ko wen de. Ehu be hia se obema wani akọ obakumi na pomidin hu.
Eni me de be ko clinic ochna. Enu nti na me de. Me ye exclusive breastfeeding 6 months. Ansa na me sha ase de nduane ahodo ama no. Aka no funsuo nko a me de ma no bosumi nsia no ho. We bo ma ne nya nduane ndo ahodo esese onya ni nyina.
Enu nti na me si ehu be hia se wodi kumi be ko wen no. Eho de omo be kire onuane kra. Obetimi di ama abofra no. Na wetimi nyini kama.
Eho de omo be kire ohia se wo se rurun sa bribia. Ansa na wa so banim. Na aboa bo ne ho ban efiri mwawa ho. Omo be san ahwe vaccines a obani hia. Ebebo ne ho ban efiri yarewa ahodo ho.
Me chamo, eyam benije pass moody vaccination. Ene enkoda ne wonyini, ene omo yie de ho nkomo. So wentimi an COVID-19 vaccine no wa bra ne wa fafura. Say de wo betimi awo.
Next time me de me ba ne beba we no. Me ne me kunu bemba. Na me ne no mienu nyina be wo COVID vaccine no.
Ehu be hia yie pa. Se wo be ma wani akọ wo ba na pomudene. Ni nyini, ene ne yie yo ho. Ya fa wo ba ne ko we yin. Se de sese wo ko.
Kaseboy, Ministry of Health, Ghana Health Service, anyone partners, and a bro.
Nake vaccination se jefe na agbo bile. Le, shino chumo ke ni bi ko me wole. Ha ni ntwemo pa vaccination se no. Je hia wa akoko bile ba be na ke habue. No ba bole chofa, no ba bo heban. Shike onye oba be ni ake habole. Ka ha ni egbo na. Bo ke bi ehohefu oba anya oba. Bo he modi akokele ba vaccination ye be na ake habue. Alo, ika hoge pi.
Eji wogbena aka wo ba kwe no obi ada jogban. Bona afi na me hu afi fel.
Obanyo set reminder your phone no. Ni ba wo bo no kai be na ke habue. Alo, obanyo ke calendar peto free j. No mark be na ke habo akeke gbeken by vaccination.
Osusu mo ene ho hiwa de enche. Keje nwene ke ya wo ba kwe ni be ni atowo. Oketuni.
Esake ohi aka be ni sani obi ya bu vaccine no. Oke ohi wale kwelo awie. Ni okwa ake obi ngbu vaccine benisa. Boni afeni ebo ame bank eje hila isoto yi. Ni vaccine banye sa.
Agafi Chaneje, Ministry of Health, Ghana Health Service, Game Walloy.
Vaccinations no ase ebi wo ho a mo anwo.
Minimpa. So ejuma semi ne akonya be nti. Aya na ma adwun kwafi. Ede wo say ye be wo vaccine no.
Ehu hia ye pa. Se obedi emra ede ahye wo se obewo oba no panye no so. Se eba se wentimi ambe wo eda ede ahye wo na. Emma ne hawo kra. Obetimi di na bada foforo. Enti wo de bomodi ase obeba da ye hye wo no. Enna kakra bi pa ho a. Enye hwe.
Asudie se, je behwe se ye ma no benyini. No mo hu so asaye fefefe.
Obetimi ye use app ewo wo phone so. Opekra obetimi the calendar above fridge ho. Na wa mark data. Esese mobile immunization.
We die eya adwen papa. Efie na ekoi die. Me hyebo se, ye bedi ye mre se de se.
Ehu be hia yie pa. Se obedi mra, ye de be hye wo se esese wo wo ba no panie so. Eno be bo wo ba na pomudin. Ene ne yie yo. Hyene nso se, se wantumi anko wo ba no panie ebra ye de hye wo no a. Etwemu kakra kra. Obetumi de wo ba na ko. Woni wo pomudin adwuma efo ni nkomo. Na wo mo ahwe se wo ba no be wo ne vaccine. Abra eselu na bo wo ba no ban efi yare ahodo ho.
Kaseboy, Ministry of Health, Ghana Health Service, anyone partners, and a bro.
Attention parents and caregivers. Did you know that measles and rubella are highly contagious diseases that can be prevented with a simple vaccination, and that vitamin A is essential for your child's growth, immune system, and overall well-being? That is why the Ghana Health Service is organizing a nationwide measles, rubella, and vitamin A campaign from the 2nd to the 6th of October 2024 to protect our children under 5 years old from measles, rubella, and vitamin A deficiency. This is your chance to ensure a healthy start and a brighter future for your little ones. Services provided in the vaccination will include measles rubella vaccination for children between 9 months to 5 years and vitamin A supplementation for children from 9 months to 5 years. The vaccination and the vitamin A will be available at health centers, schools, markets, bar stations, churches, mosques, and within communities across the country. No one should be left out because it is free. So join us in keeping our children safe and healthy. Remember, from October 2nd to 6th, and it is free. Let's bring our children to benefit from the vitamin A and measles rubella campaign for a brighter tomorrow and good life. Live it well. This is brought to you by the Ghana Health Service and its partners.
Your child has lost weight, but I feed him every day. Have you taking him for weighing.
It is very important to track your son Kumi's growth to ensure he's developing properly. Then I will take him to the clinic tomorrow.
That is why, for me, after exclusively breastfeeding my baby for 6 months, foods.
It's been a time when we wonder how to move and do what we love. Rubella and measles could be similar in its ways, but you need details to explain. When we read all the details about how it feels, look at the symptoms and how it shows. You and me would fibers, the vitamin A supplements will do the trick. You could be part of the solution. We all have a role to play. You had the 6 childhood killer diseases. With time, with development, lots are coming out. It's becoming complicated, and the implications diverse. Health solutions, we all have a role to play. You could be part of the story. You know exactly what it's all about. Oh, oh yeah. Young nurses and all health personnel in the hall, take the day as it comes. You have a role to play. You and I have a special role to propagate the good news. We could do it. Oh yeah. We would make it work someday. Would you like your kids to have a good health? You see the nurses by the table. When they knock on your doors, please allow them. Treat them right to get it right. Well, I'm sure our queen mothers will agree with me. Our friends from the church equally would agree. Vaccinations within the nations wouldn't be an excuse for everybody to pay. Sometimes when they knock on your door, you might be in disagreement with their presence. You may not hear the publication or adverts. Take your time and understand. We all have a role to play to fight measles and rubella. Tell your friends to tell a friend and tell another friend or relative. We have a role to play. have a special role to inject this idea out of humility. Let's express ourselves with the right attitude, with love in our hearts. Tell them the truth, be honest and sincere. That's the meaning of health. It goes all around. The state of complete mental, physical, and social well-being, and not merely the absence of diseases and infirmity. That's the definition of World Health Organization. Currently, you have technology. You and I have a role to play all day long, 24/7, 365 quarter days. Through the years, that's something you need to know. Health is a matter of concern. Tell your brothers and sisters, tell your neighbors and friends in your communities, nurses, when you get to the communities. Make sure you bring them the right information. That's exactly what they'll require. You and I need each other, moving on every day. Wow, let's wow this idea. Let's move to the villages and hamlets, through the cracks and crevices of life. Come on, everybody, let's move. La la la. Ooh. La la la. Ooh, yeah. There is beauty all around when there's love at home. If there's equally some health for all their kids at home. Love at home. Love at home. When our health is well restored, we would have this love. Madame Ness called love, you brought us here. She's the host of everybody here this morning. Well, Mr. Jake, in your capacity as PR, bringing the good news around. We would vaccinate our kids right on time before health challenges stand in the way. We will educate our kids, that's exactly what we'll do. We will move on without a break. This song that I'm going to sing makes no sense, but we can grab some meaning out of it. You can tap your feet on the rhythm and we'll pick up something from there, and whilst we get along. Life, in fact, makes no sense sometimes, but we'll put one and two together and we'll work something out. You can learn and sing it along if you want. We can do it together one more time. Sometimes out of exhaustion in the night, waking in the morning, driving through the hectic traffic. Phone calls upon phone calls will be bagging your phone. You may not know exactly how to contain. I know the queen mothers will testify sometimes, lots of phone calls. People are asking for school fees. People are asking for monies for hospitals. Children, kids, and all the elderly knocking on your doors. That's the way it goes sometimes. Come on, everybody. Dum bum, dum bum, dum bum, dum bum, dum bum, dum bum. World Health Organization has been critically concerned about restoring health in communities all across the world. It's part of their development agenda. It moves from stage to stage. There are actions and steps well taken. Come on, everybody. In some of the pages of their health policy, breaking through the barriers of culture, making sure health is well restored. Sometimes they would have to contend with religious contentions, and equally lots and lots of soundry. Come on, everybody, let's get it all along. Come on, everybody, would you help? Sometimes we talk about breastfeeding for over 6 months. That's a health requirement to promote. Breastfeeding is an exercise for the kid to grow lots of nutrients to build up immunity. Immunity against diseases can be fought psychologically and equally physically. Come on, everybody, let's do it. Let's welcome, ladies and gentlemen. Let's acknowledge the DG. Come on, everybody, let's get it on. Come on, everybody, let's sing it. Let's humbly educate everybody with the right attitude and love. Health is a state of concern for every situation. Let's go all around and find the answer. Come on, everybody, let's get along. Yeah. Oh, well, I realize my lyrics is running out. Thanks for bailing me out. So then, la 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 la. Say, man, show me who better me. Now I'm getting to the end of the song.
Good morning, distinguished ladies and gentlemen. Let me first of all apologize. As I indicated earlier on, there were a couple of equally important activities in town, and we had to attend to them before we came here. So thank you once again for making time for us and also being patient with us. We won't waste my time. We'll start the program on behalf of the Director General of the Canal Service. I welcome all of you to the launch of the Integrated Measles Rubella Vaccination and Vitamin A Supplementation Campaign, anchored under the theme Measles and Rubella Care. Vaccinate your child now for good life. Once again, let me welcome all of you to this morning's launch. We will start the program with an open prayer, and I'll call Mr. Kwesi Fianko to do that for us. Please help me welcome him.
Please let's bow for a prayer. Our God in heaven, we thank you for this morning. We commit today and this activity into your hands. We pray that you guide us to a successful end. In the name of Jesus we prayed. Amen.
Thank you very much. Before I introduce our chair, let me introduce our dignitaries who are in our midst. The host of this meeting, the Director General of the Canal Service, we have Dr. Patrick Kumar. Thank you for coming. Please, let's clap for them as they are introduced. Then we have Dr. Franklin Esiedubekwin, who is the Director Public Health Division of the Ghana Health Service. We also have Dr. Kwame Amponsa Achiano, who is the Program Manager, Expanded Program on Immunization of the Ghana Health Service. Then from the partners, we have Dr. Frank John Lule, Officer in Charge, WHO Ghana Office. After the other, we have Na Adole Abladi the first, Simpe Newtown, Shukura, Queen Mother. Then we have Na Koko Ajioyi. I hope this time around I got it right. Yes, Ajioyi, Adabraka, Queen Mother, also here in our midst. Then we have Na Ashami, Myra, Queen Mother, also here. Thank you. Na Bawa, Papa Asi, Queen Mother, also here in our midst. Thank you. Na Abakwano, Dansuman, Queen Mother, also here. Yes, thank you so much. We'll introduce the others as and when they join. Then let me introduce our chair for today's session. As we are talking about children, we needed someone who has experience in children to chair for us. Our chairperson is a highly accomplished educationalist with over 20 years of experience in early childhood education, which is also complemented by a background in human resource management. Her expertise is highly respected in her field. She holds an international Montessori teaching diploma 1 to 3 and 3 to 6 years, and is a certified lay counseling psychologist by the College of Counseling and Psychology of the University of Ghana, Legon. Currently, she serves as the president of the Greater Accra Regional Early Childhood Council and is the directress of the Christ Reigns Montessori School. Additionally, she's a dedicated wife of a Christian man called Mr. Ani Asameni and a proud mother of 6 wonderful daughters. Distinguished ladies and gentlemen, I present to you Madam Lydia Ofosua Ani Asameni as our chair for this morning's program. Please,
Madam
let's do better for our
Lydia
chair.
deserves a round of applause from everyone with childhood experience that is right. Oh yeah, one more time, a resounding round of applause.
Thank you very much, Mr. MC. Good morning, everyone. Honorable Minister of Health, Director General of Ghana Health Service, our development partners, directors from various ministries, departments, and agencies, our lovely Queen Mothers, distinguished mothers and babies, members of the press, ladies and gentlemen. I am delighted to be called upon to chair this important meeting. I want to begin by expressing my deep gratitude to all of you for joining us today as we embark on this important mission, an integrated campaign of measles, rubella vaccination, and vitamin A supplementation to reduce the burden of measles and rubella in our communities. This campaign represents a collective commitment to safeguarding the health and future of our children, families, and nation. I am honored to see the remarkable collaboration between healthcare professionals, educators, and community leaders in making this vaccination campaign a reality. Our efforts today are not just about administering vaccines, but about protecting the lives of millions and preventing the devastating impact of these diseases. Measles and rubella, I am told, are preventable, yet they continue to pose risk, especially to our most vulnerable, our children. By integrating our vaccination efforts, we are maximizing resources, reducing barriers to access, and ensuring that every child is given a chance to live a healthy, productive life. I want to take a moment to thank our frontline health workers, who are the backbone of this campaign, and all those who have contributed to its planning and execution. Your dedication and hard work will have a lasting impact. As we move forward, I would encourage everyone, especially my colleague educators, to continue to spread the word, encouraging families to vaccinate their children and remaining vigilant in our fight against these diseases. Together, we can and will achieve a goal of a healthier, safer future for all. With these remarks, ladies and gentlemen, I accept to chair this function and request the cooperation of all to help me steer the affairs of this program to a successful end. I thank the organizers for the honor bestowed on me. Thank you all very much. You are all welcome. Thank you.
Thank you very much. Let's do it better for our chair. You can see that she's in the best position to chair this morning's program for us. Before we take the welcome address, let me introduce other invited guests who are in our midst. From the Office of the Chief Imam, we have Mr. Yusuf Abdallah here in our midst. Thank you for coming. Then from the Ghana Red Cross Society, we have Mr. Thomas Apori. Thomas is also here. Then we have members of the Church of Jesus Christ of Latter-day Saints, led by Madam Marianne Esiape, also here in our midst. Thank you for coming. Then we also have officers from the Early Childhood Council in our midst. Let's see you if you are here. Thank you all for coming in your numbers. Then we have Na Uheche, Soko Queen Mother, also here with us. Let's see you. Thank you so much for coming. Then members of the Ghana Coalition of NGOs in Health, you are also here. Let's see you. They are behind us. Thank you all for coming. So I will call on the Director of Public Health Division of the Ghana Health Service, Dr. Franklin Esi Dubekwe, to formally welcome us to this launch. Please help me welcome him with a round of applause.
Thank you very much, Jacob. So, Madam Chairperson, the Director General of the Ghana Health Service, Dr. Patrick Kumar Bwaje, the WHO Officer in Charge, Dr. Frank Lule, Directors of the Ministry of Health, Ghana Health Service, and other staff gathered here, our development partners, members of the Council for Private Early Childhood Growth and Development, members of the Church of Jesus Christ of Latter-day Saints, Queen Mothers and other traditional leaders, religious leaders, the press, distinguished guests, our dear mothers and children, ladies and gentlemen, good morning. I deem it an honor to welcome you here today to launch the integrated measles rubella vaccination and vitamin A supplementation campaign. This campaign marks a significant step forward in our collective efforts to halt the spread of measles and rubella in our country and to improve the general well-being of our children. I would like to begin by acknowledging the tireless effort of our healthcare workers who have been at the forefront in the fight against vaccine-preventable diseases. Your unwavering dedication and commitment to the health of the people of Ghana is highly commendable. I extend my deepest appreciation for your expertise, sacrifices, and determination to protect us all, especially mothers and children, from vaccine-preventable diseases. I would also like to recognize and acknowledge the support we have received from our valued development partners, dedicated civil society organizations, the media, and all gathered here today. Madam Chair, measles is a dangerous disease which can kill a child or cause a lifelong disability, including blindness, brain damage, and deafness among children. Rubella, on the other hand, causes serious birth deficits if contracted during pregnancy. Vitamin A helps with vision and protects children from diseases. Therefore, an integrated measles rubella vaccination and vitamin campaign for children under 5 is welcoming and timely as it to prevent further surge in measles cases across the country. Our gathering here today reaffirms our commitment to ensuring every child in Ghana receives a healthy start to life. This campaign therefore calls for everyone's commitment to ensuring maximum uptake. When we work together, that is, government agencies, health workers, volunteers, community leaders, and caregivers, we will achieve our goal of protecting the health of all children living in Ghana. As we launch this campaign today, as a prelude to the start of the campaign, which starts from the 2nd to 6th of October 2024, let us remember that our actions today will shape the health outcomes of future generations. Together, let's make a lasting impact in the fight against measles, rubella, and other vaccine-preventable diseases in the country to ensure a healthy future of our children. Madam Chair, distinguished ladies and gentlemen, on this note, I extend a healthy welcome to all of you for this very important event. Thank you very much.
Thank you very much, Director of Public Health. Thank you for that welcome remarks. We are also privileged to have other directors from the Ghana Health Service in our midst. We have Madam Mabel Asafo, who is the Acting Director, Health Promotion Division. Let's see you. Thank you so much. And her deputy is also here, Madam Bridget Enim, also here with us. Thank you for coming. We also have our women's group. They've been here since morning. Let's see you. Let's show appreciation to them. Let's show appreciation to them. Thank you for coming to support us. Then the Municipal Director, Metro Director, Accra Metro, Dr. Esther Odame, is also here. Thank you for coming, Director. So take some messages from our partners, and in no particular order, I'll call on the officer in charge of WHO Country Office, Dr. Frank Lule, to give us the first message. Please help me welcome him with a round of applause.
Thank you. Madam Chairperson, the Director General, Dr. Patrick Kuma Boaje, the Director of Public Health, Dr. Franklin Isiedo Bekoe, Directors of the Ministry of Health and Ghana Health Service, distinguished traditional leaders, colleagues from partner organizations, friends from the media, distinguished invited guests, ladies and gentlemen, good morning. I bring you warm greetings from the WHO leadership here in Ghana, in the regional office in Brazzaville, and also from headquarters in Geneva, Switzerland. And it is a great honor to join you today for the launch of the measles and rubella follow-up campaign here in Ghana. This campaign aims to protect every child from measles and rubella and improve the health and well-being of future generations. Ladies and gentlemen, first and foremost, I would like to thank the Ministry of Health and the Ghana Health Service for their unwavering commitment to eliminating measles in Ghana. Through comprehensive immunization strategies, improved case management, and essential childhood interventions, Ghana has made remarkable progress in reducing deaths from measles to almost zero. This is no small feat and is a testament to the dedication and hard work of healthcare workers across the country. Measles, colleagues, is a highly contagious airborne disease caused by a virus that can lead to severe complications and in some cases death. It is a disease feared by many, and rightly so. Before the introduction of the measles vaccine in 1963, I see very few were born by that time. Major epidemics occurred every 2 to 3 years. And at that time, we were losing between 2 and 3 million people every year because of measles. It's hard to imagine the devastation measles caused before vaccines became widely available. Ladies and gentlemen, even though a safe and cost-effective vaccine exists, the reality is that measles remains a threat. In 2022, we lost about 136,000 children due to measles globally, and most of them were unvaccinated or under-vaccinated children under the age of 5. Unfortunately, the proportion of children receiving the first dose of measles vaccine in 2023 stood at 83%, well below the 2019 level of 86%. This drop in immunization rate is really concerning. COVID-19, the pandemic significantly disrupted global health systems, leading to setbacks in both surveillance and immunization efforts. The suspension of routine immunization services, coupled with declining coverage, left millions of children vulnerable to preventable diseases like measles. No country is exempt from this risk. In areas with low immunization coverage, the measles virus can circulate freely, increasing the likelihood of outbreaks and putting unvaccinated children at grave risk. Distinguished invited guests, here in Ghana, the delay in conducting the measles and rubella follow-up campaign, along with vaccine supply challenges, has led to an increase in cases since 2022. In fact, during the recent outbreak, I'm informed some schools, especially in the northern part of the country, were forced to close. And some families even relocated from the most affected areas out of fear of contracting the disease. This fear is not only about health, but also the economic and social burdens that a single measles case can place on a family. Let me share the story of one measles case in the central region. A young child named Kofi contracted measles in March of this year. Although he recovered, the impact on his family was profound. His mother had to stop working for nearly a month to care for him. And the family's economic situation was severely affected as they had to spend their limited resources on medical bills and other expenses related to Kofi's illness. While Kofi's life was thankfully spared, the economic and social consequences were long-lasting, demonstrating that even a non-fatal case of measles can ripple through a family and a community, affecting education, livelihood, and well-being. Dear colleagues, this campaign provides an opportunity not only to protect children from measles and rubella, but also to offer them additional health benefits. Vitamin A supplements will be administered as part of this campaign. Vitamin A is essential for the functioning of the immune system and plays a vital role in the healthy growth and development of children. Ensuring that children receive this essential nutrient will further strengthen their resistance to illness and promote their overall health. I urge our districts and facilities to fully utilize the resources available for the measles rubella campaign to integrate routine immunization, particularly in areas with low routine immunization coverage, hard-to-reach regions, and underserved communities. This will help reduce the number of zero-dose and under-vaccinated children. I want to take this opportunity to extend my heartfelt thanks to all our partners for their continued support to the Ghana Health Service. Your collaboration has been instrumental in building one of the best immunization systems in Africa. And let's not take that for granted. This achievement underscores what we can accomplish when we work together toward a common goal. Now to our friends for the media. I urge you to partner with the government and partners in accurate, positive information about this campaign. Your role is important in generating demand and ensuring that every child under 5 years of age is vaccinated. I urge you, the media again, to share accurate and encouraging messages to help families make informed decisions and protect their children from entirely preventable diseases. Ladies and gentlemen, in closing, I want to express my gratitude to every one of you for your presence here today. Together, we can ensure that every child in Ghana is given the chance to grow up healthy, strong, and free from the threat of measles and rubella. Let us continue this work with a sense of urgency and commitment. Thank you so much for your attention.
Thank you very much, Officer in Charge, Dr. Frank Lully, for that address. Please, let's put our hands together once again for him. We are also privileged to have tutors and students from the Public Health Nursing School, Kolebu. Let's see you. You came in your numbers. Thank you for coming. We are also live on the Ghana Service Facebook page, so if you are here, just take a time, follow us, and share the link so that others who are not here can also listen to what you are saying here. When it comes to immunization, the service enjoys a lot of support from religious groups, especially when it comes to social mobilization. One group has also been very consistent, and they are here with us today to share some few words with us. Distinguished ladies and gentlemen, I present to you Madam Marianne Esiape, the officer in charge or the rep from the Church of Jesus Christ of Latter-day Saints, to give us an address. Please help me welcome her with a round of applause.
Madam Chairperson, Director General of the Ghana Health Service, distinguished Queen Mothers, esteemed partners, all protocols observed. Good morning. Is it afternoon? Good afternoon. Thank you for inviting the Church of Jesus Christ of Latter-day Saints to be part of this important event. On behalf of the Church, I'm honored to stand with you today at the launch of the Integrated Measles, Rubella, and Vitamin A campaign by the Ghana Health Service. During his earthly ministry, Jesus Christ showed unwavering love for children, healed the sick, cared for the poor and the needy. His compassion continues to inspire us today. Following his example, members of the Church of Jesus Christ of Latter-day Saints are devoted to serving those in need, and today with a special focus on children. Through volunteer work, collaboration, and general donations, we reach communities around the world, offering healing, support, and the tools for self-reliance. This commitment to lasting change is at the heart of all the humanitarian work the Church embarks on. The Church has had the privilege of collaborating with the Ghana Health Service over the years since 2012 with regards to humanitarian efforts. As a church, we believe in the well-being of individuals, both spiritual and physically. We are deeply committed to supporting initiatives that promote the health and vitality of individuals, most especially children. I believe that's why we're all here today, because every child deserves a healthy start to life and the chance to reach their full potential. This campaign to fight measles, rubella, and vitamin A deficiency is a crucial step in saving lives and preventing suffering. We are grateful for the opportunity to contribute to such a noble cause. Our faith teaches us the importance of caring for the vulnerable, and no child should endure the effects of preventable diseases. As we join hands to launch this initiative, let us unite in purpose, knowing that together we can protect and uplift each other. We stand in solidarity with the governments of Ghana, health workers, and everyone who has worked tirelessly to bring this campaign to fruition. With God's help, we can make a lasting difference for generations to come. Thank you. May God's blessing be upon this work and us all. Thank you for having us.
Thank you very much, Rev. from the Church of Jesus Christ of Latter-day Saints, for your continuous support. We'll take a very short musical interlude from our soloist, Mr. Kabono.
This will be a short song. It wouldn't last for more than 2 minutes. That's all I know about. It's all about you, you and me. Just like she said, we have to do this together. Every time, any day, we need to raise the flag of awareness and real controls, and we need to do it together with all the stakeholders in the matter of health. You and I deserve the very best in time, just as our friend from the World Health Organization, Dr. Franklin, when you held the microphone, you did it right. When the specialist even in Montessori schools, She really did it right, and then you from the other day sing, making sure everything is alright. Saying you, me, all of us will have to participate. Switch on the microphone, switch off the microphone. Otherwise the feedback wouldn't be relevant to this conversation. Let me tell you this one. You and I and all of us, including our beautiful queen mothers, who deserve a resounding round of applause. The directors in health and all health stakeholders, you and me will make it right.
Thank you very much. That was short indeed. We are behind time. So take the presentation for the day on the update on measles, rubella vaccination and vitamin A supplementation in Ghana. And this is going to be done by Dr. Kwame Amponsan Achiano, the program manager. Please help me welcome him.
Thank you very much, Mr. MC. I think it's afternoon now. Good afternoon, everybody. The Director General, Ghana Health Service, Madam Chair, Officer representing WHO Country Office, distinguished partners, ladies and gentlemen. My task is huge, but I hope that I'll be able to deliver because it's a technical presentation. And the communication bit has always been challenging. Yes, my name is Kwame Amponsa Achiano from the Ghana Health Service. I'll take you through the reason we are doing this campaign in that very technical form. But I'll try as much as possible to also be very, very, very low in terms of the technical jargons. So I'll follow an outline like this. The next slide, please. Okay. It's too far away. Next slide, please. Yes, so I'll take you briefly what the diseases are, measles and rubella. We'll look at some elimination goals in terms of the global elimination as well as the progress Ghana has made towards elimination. And then the rationale for this particular campaign, our target and the scope, and we draw a few conclusions, and then we summarize. Unfortunately, the pointer is not working, so you may have to control it for me from there. Thank you. Yes, so the immunization programs all over the world actually aim at reducing morbidity and mortality, or in other words, illness and deaths due to vaccine-preventable diseases or diseases that are preventable through vaccination. And we in Ghana, we started our program in 1978 when the country launched the then 6 childhood killer disease antigens. At the time, measles was part of the 6, and it still continues to be part. So we're giving BCG against tuberculosis, diphtheria, pertussis, and tetanus vaccine against diphtheria, pertussis or whooping cough, and tetanus. And then oral polio vaccine for polio. And of course, as I stated, measles was part of it. Measles and rubella are both viral infections transmitted mainly through aerosols or, simply put, airborne. And it's usually from person to person. However, rubella can also be passed from the mother to the child through the placenta. And when that happens, the unborn child develops what we call congenital rubella syndrome. Next slide, please. So I'll focus a bit on measles, and I'll also talk briefly about rubella. So as we said, measles is an infectious disease, meaning it can pass on from one person to another. It's caused by a virus, the measles virus. The transmission, again, person to person, through respiratory droplets. And the time of infection, when somebody contracts measles virus, the time from that contraction to the time that the disease manifests takes about a week. But it can be up to almost 3 weeks. The signs and symptoms. Next slide, please. The signs and symptoms or the manifestation of the disease usually starts with a pre-disease, normally known as prodromal symptoms. And this lasts about 3 to 4 days. And usually during that period, before the rashes, the typical measles rashes appear, we have low-grade fever, red eyes, or in medical terms, conjunctivitis. We have rhinorrhea or runny nose. The child may have some runny nose. And then some whitish patches in the corner of the inner parts of the cheeks. And usually after 3 to 4 days, this will be followed by very high-grade fever. In other words, the child becomes very hot. And then the rash starts appearing, usually from the hairline, and then proceeds to the rest of the body. These rashes have the tendency to come together, to unite. That child may also have cough. Measles can be complicated, we've already learned that, by either the child becoming blind or deaf or having brain damage. The child may be malnourished or may develop pneumonia, diarrhea, or seizures. And usually death could occur, mostly due to pneumonia. Next slide, please. So in Ghana, as we've already learned, measles, even before the advent of vaccines, used to be a very difficult problem. A lot of cases occurred, and especially before the 80s. It ranked as the number 2 cause of death, only second to malaria in terms of disease burden and death. And it accounted for nearly 7% of healthy days of life lost. In other words, illness, disability, and death. Again, in Ghana, next slide, please. There was nearly universal childhood infection. Almost every child born before the era of 1978, when vaccination started, had measles. And incidentally, yours truly standing here, my mother tells me I had measles. I was born before that, unfortunately. So it's only by the grace of God that I'm alive. It also accounted for nearly 9% of all admissions in the big teaching hospitals, the then two teaching hospitals, Kolebu and Konfanochi. And I remember teachers used to tell us how measles ravaged children during those days. When they entered the wards, there were many, many admissions, about half of them measles. And by the following day, when they come, about a third of them would have died. Such was measles in those days. So it accounted for 1 death in 5 admissions among children under 5. And the commonest cause of death was pneumonia. Next slide, please. Now a bit about rubella. Rubella and measles look very much alike. So in general parlance, rubella is usually known as German measles. So it's a form of measles in a way. It's also contracted the same way that measles is contracted. It is caused by another virus known as the rubevirus or rubella virus. As we said earlier, rubella is acquired in 2 ways. Number 1 is when it passes from one person to another through the droplets. But the second part is when the mother passes on to the unborn child, which usually leads to devastating consequences. Again, the time of infection to the disease itself takes about 3 weeks. It's very similar to measles, but it lasts longer. It's about 2 to 3 weeks. Next slide. The signs and symptoms, again, are very similar to measles, but are generally milder. And mostly, if you have 10 people with rubella infection, 5 of them may show nothing at all. So only half usually will manifest as initial symptoms, not really apparent, but the rashes are fainter compared to measles. And usually this one does not come together unlike measles. Another difference is that for rubella, you have enlargement of the lymph glands, especially around the neck. But it's difficult, essentially, to differentiate between the two. So if you look down there in the right corner, lower corner, you see a typical rubella rash. But from afar, you can also say this is measles. Very, very similar to measles. Next slide, please. As I said, rubella usually involves the lymph glands or lymph nodes for that matter. Then the joint may also be involved. And babies may be born with deformities if the infection occurs in early pregnancy. Complications due to rubella are usually rare, but when they occur especially in adults. It's commoner in adults than children. And this may include brain damage, peripheral nerve damage, inflammation of the testicles or swelling of the testicles, which obviously might lead to infertility. And then, as we said earlier, congenital rubella syndrome, when it affects a pregnant woman in early stages of pregnancy. And down there you see a child with typical congenital rubella syndrome. But I'll look at more of the symptoms and signs of congenital rubella syndrome in the next slide. So rubella results when congenital rubella syndrome results when rubella infection occurs in pregnancy, and for that matter, very early pregnancy. The child may be born deaf. Can you imagine a newborn who is born deaf? The child may have cataract or white pupils. They may have other eye diseases. They may have hole in heart or heart defects. They may have a very small head. They may be mentally retarded. They may have bone alterations and other organ damages, including liver and spleen damage. And then they may also have bleeding into the skin, known as petechial rashes. And they may have a range of other conditions, even including diabetes and autism, unfortunately. And this is no fault of the child's. So on the right side, you see a child with typical, next slide, typical congenital cataract. Next slide, please. So you see it's white. A newborn born with cataract from the onset. Next slide, please. So in the next few slides, we'll talk about the progress we've made in terms of measles and rubella elimination. So in 2011, in fact, as I said, from 1978, measles has been part of our immunization program. But in 2011, Ghana, as part of the 46 countries in WHO African region, signed onto the regional measles elimination goal by 2020. And that we're using 3 main strategies. Achieving routine immunization coverage for the 9-month coverage, the 9-month immunization coverage, and then also the 18-month, the second dose, at least 95%. And then number 2, also achieve at least 95% for supplementary immunization activity. And then the other strategy was to confirm measles incidence of less than 1 case of measles in 1 million population across the entire country, and of course for all those African countries. And then the other target was that we would have no congenital rubella syndrome through endemic transmission, meaning there should be no local transmission, for which reason we would get congenital rubella syndrome. Despite the fact that we could not reach these targets, elimination targets in 2020, a lot of progress has been made. Implementation of these measles elimination strategies have substantially reduced measles illness and deaths over time. And you will agree with me that measles is now a rare disease, even though we see some cases here and there from time to time. But it's very, very much rare to the extent that even medical students may not have seen measles in their consulting room, and then especially the newer doctors. Next slide, please. Yes, so there's a new strategic framework for measles elimination, measles and rubella elimination. There's a renewed commitment to go back on track to reach the elimination goal after COVID. The Measles and Rubella Strategic Framework 2021 to 2030 envisions a world free from measles and rubella. And the goal is to go back on track, achieve and sustain the regional measles and rubella elimination goals by 2030. And this means for Ghana, being part of the WHO Afro region, we would have no indigenous measles case for at least 12 months within a functional surveillance system. And that is what we are striving to achieve. And then also for rubella, there should be no congenital rubella syndrome case associated with endemic transmission. In other words, locally, generated locally, for at least 12 months, again, within a functional surveillance system. Next slide, please. So the strategies for elimination within the renewed framework remain the same. Would achieve and sustain at least 95% coverage for measles rubella vaccination for both the first and the second doses at the national level and in all districts. Again, would have to achieve at least 95% of measles rubella vaccination during supplementary immunization activities, one of which we are just about to start, again in all districts and also nationwide. And then, of course, achieve the surveillance performance targets for both measles and congenital rubella syndrome. Next slide, please. Sorry, this is clear on my PC laptop, but unfortunately very, very blur here. But essentially to show us the global estimates, very recent estimates of measles. Where you have darker blue is where you have the problem, most of the problem. If you look at the African map, there are places that are very dark. Of course, Ghana is also dark, but it's not as dark as the darkest. What it means is that we are doing well, but we still have a long way to go. And this is very, very recent. Next slide, please. So in terms of progress, again, we started our program in 1978. We've come a long way. We have this slide to show how far we've come in terms of the contribution of vaccination to the control of measles in particular. If you look at on this graph, you see very tall bars. The tall bars represent the disease. The taller the bad the case is. And so from the beginning, somewhere 1994, we had very tall bars. The green line shows us how far we've come in terms of coverage of vaccination. So you see that it's going up. The green line is going up until the recent dip in 2023. So as the green line goes up, you see that the bars are reducing, meaning the cases are going down. And that is a clear case of the impact of vaccination on the disease. And more so when we do the supplementary immunization activities, where you have the blue arrows pointing down. So we did one in 2002, another in 2006, another one in 2010, then we did 2013. The last one was in 2018. If you look at this, you could see that in cyclical form, we've been doing the supplementary immunization activities every 3 to 5 years. So the last one, which was in 2018, means we have a gap of 6 years. And that is why when the officer in charge of WHO was making his presentation, he mentioned the fact that there's been a delay. And so the time to have done this was around 2022, but we still have the opportunity to do it. And because of that gap, you see that the bars have started going up. And therefore, this is about time we did another campaign. But overall, cases have gone down with the routine. Next slide, please. Yes, just to show that even though we have rising coverage levels from somewhere 1978 up to most recently, we still have district pockets of inequities where the districts, those, in fact, all we want to see is deep green everywhere. This is the map of Ghana. So there are some districts where we have yellow. We don't want the yellow. We want more of the deep greens. There are even 1 or 2 areas that are red. Red means don't go, which means the coverage is less than 50%. So ultimately, we want to get to all greens. And this is for the one that is given at 9 months. The next slide, please, is showing us the dose 2, the one that is given at 18 months. Of course, there's always a lag between the vaccines that are given in the first year and then those that are given in the second year. Essentially, we are also doing quite well, except that we could do better. But compared to the 9-month vaccination, it's a bit on the lower side. Again, we want to see greens all through. This is for the routine immunization. And for measles control or measles elimination, the bedrock is routine immunization. Next slide, please. Yes, this is the number of cases we have recorded in terms of the past 2 or so years. So from 2022, 2023, in fact, 2023, in the past 3 years, 2023 was our worst case. However, on the right side, which is 2024, is just half year compared to the full years of 2022 and 2023. Meaning if we should go at the same rate, we are likely to even surpass 2023 in terms of the number of cases. And therefore, we need to do something extra. Next slide, please. The next slide shows us, is showing us the children who are most affected in terms of measles. So the age groups. And it's usually the 9 months to the 5 year, those who are yet to attain 5. Of course, there are other age groups that are also affected. But essentially, those categories, the 9 to 2 years, and then 2 years to 5 years, they are the most affected. Next slide, please. A bit about rubella control. As I said, rubella and measles go together. So rubella is endemic in Ghana. Since 2003, all negative samples that we test for measles, all the samples we test for measles that test negative are also tested for rubella. And we've realized that we get quite some numbers of rubella cases. So we also have a surveillance system to track congenital rubella syndrome, which we worked with Confanochi Teaching Hospital on. So until 2013, when the rubella vaccine was introduced as part of the measles vaccine, there was no specific intervention for rubella control. So we started with measles alone, and then in 2013, we added rubella. Next slide, please. Yes, so I was talking about the surveillance system that we are operating with support from Confanochi. And before the introduction of the rubella vaccine, we had a rate of about 8 per 10,000 live births of congenital rubella syndrome. That was scary. And so the sentinel surveillance was reactivated after the introduction of the vaccine. And you see in the next slide, or on the next slide, cases have reduced, but we still have quite some substantial number of cases. So from 2011, you have about almost 600, and we've been coming down. I think our best was when we started in 2013, then in 2016, I think it was our lowest number of cases of rubella. In the past 3 years or so, cases have also started going up. Next slide, please. So again, if you look at, not the previous slide, if you look at the age group that is affected, it's still the 9 months to 11 months, and then also the 1 to 4 years. So it's still the 9 to under 5 who are most affected in terms of the numbers. Next slide, please. So our progress, we've improved on surveillance for both measles and rubella with good surveillance indicators. Between 2003 and 2021, our surveillance records showed us that we did not record any death from measles. We also have very high measles and rubella vaccination coverage rates, as we've already indicated, especially for the dose 1, the one that is given at 9 months, until our recent dips. However, no matter the effort we put in, we are not achieving 100%. So we achieve around 95%, sometimes a little less than 95%. So you have about 5 to 10% of children who are left out every year in the routine. And if you extrapolate based on our total birth cohort, what it means is that we are leaving a whopping 70 to 100,000 children behind. And over time, if you have this for, say, 4 or 5 years, you are talking about 500,000 children who have never probably received the measles rubella vaccine. So over time, these susceptible children build up and become a fertile ground for outbreaks if nothing is done. And in fact, this is what we have been seeing over the past several months. So next slide. Ghana is working towards achieving measles and congenital rubella syndrome elimination. However, confirmed cases of measles and rubella have been increasing since 2021, and more so after the last supplementary immunization activity in 2018. That last campaign actually led to further decline in cases, but beyond that, cases have started rising. So you can see from this slide that we have quite a number of cases, especially for 2013. We had more than 1,300 confirmed cases in 2013 alone. And then for half year 2023, and then for half year 2024, we have nearly 620 confirmed cases. Again, as I stated earlier, we have been leaving out approximately 70 to 100,000 children because we don't achieve 100% coverage. And these, once they are left out every year, they accumulate and would be the focus for measles and rubella outbreaks if they remain unreached over time. Next slide, please. So measles elimination is only possible if population immunity is kept at more than 95% for very long periods through both the routine and the supplementary immunization activity. We've already talked about the dips in the coverage levels in the routine, especially in recent times. But there's still a strong drive for the elimination of these diseases, not just nationally, but also internationally. There's also the need to sustain the gains we've made so far and make further progress. The measles rubella follow-up vaccination campaign, therefore, will provide us the opportunity for the under-immunized and the missed-out populations to have additional protection, and especially for those who have already even been vaccinated. This, we know, will reduce measles and rubella incidence. Next slide, please. So, what are the timings and the targets and the scope? Just as previous speakers have already mentioned, we are doing the campaign from tomorrow, starting tomorrow. It's a 5-day exercise. We hope to complete it by the 6th of October. The campaign, as again we know, is being integrated with vitamin A supplementation. And vitamin A, we know, improves eyesight and boosts child immunity. And therefore, any opportunity to combine this is very welcome. And our target for this particular campaign still remains the most vulnerable, the 9 months to 59 months, or just as when the child is about to be 5 years. The scope is nationwide, so it's from Zuarungu to Diskov, everywhere. And the target population is nearly 5.3 million of these children. Next slide, please. So these are things we have done already. This is just our timelines. We've completed most of the activities. We've done our planning meetings with the regions. The regions are doing theirs with their districts. By now, they are done. We've done our tools, our communication materials. We've shared some of them electronically. We used to do a lot of technical working group meetings. We've done that as well. I've mentioned the fact that the national regional planning meetings have been concluded. The district is still doing their trainings. We've sent, through the Director General, campaign funds that have been sent to them. We've distributed our logistics. We've trained our supervisors from the national level to go and support them, and they are in the field now. And the launch is today, which we are doing. We are doing also what we call a pre-campaign assessment, where we find out how ready we are in terms of preparations for tomorrow. And then, of course, the actual implementation is tomorrow up to 6th of October. I've already mentioned the fact that we've deployed supervisors and monitors onto the field. And they will be there until the campaign is over. Next slide, please. So in summary, I'll say that Ghana has been implementing the WHO Afro recommended strategies for control of measles and rubella. There's been a lot of progress made, but we still have a long way to go. We know we have some susceptible children that have built up over the past 4 or 5 years, and we have to intervene. These children are totally left out, or they are non-immune in total. Next slide, please. We need to sustain the gains that we have made so that we go back on track towards the elimination goals. Hence, we are calling for this integrated measles, rubella vaccination and vitamin A supplementation activity. Would ensure that we achieve at least the 95% coverage target. And this we will do through our surveys, not just the administrative data, which we collect when the campaign is on, but even after the campaign, we'll still go back and do a survey to check. Of course, effective social mobilization and appropriate communication will contribute to high coverage. A call to action to support the vaccination campaign is now, because our children, as you know, are our future. So all hands have to be on deck. Distinguished ladies and gentlemen, thank you for your attention.
Thank you very much. Let's do it better for the program manager. That was Dr. Kwame Amponsan Achiano, the program manager, giving us an update on the measles, rubella, and vitamin A supplementation situation in the country, and also the rationale for the upcoming campaign. Thank you so much. Before we take our keynote address, we'll take a short musical interlude from Mr. Kabono.
Day inside, that day inside, oh, we day inside. Everybody go day inside, oh. Your mama go here, your papa go here. Everybody would be involved. That's how it would be. The vitamin A supplement has a lot of advantages, not disadvantages. Right from tomorrow till the date of completion, you and I go day inside. Right from this afternoon, moving on the periods, the rains, you and I go do amo. We go do amo, do amo. We go do them together for success. We go do amo together. When our directors sit in the offices, sometimes we criticize them. They've been working hard. What you saw displayed on the screen, a lot of activities have been completed. A round of applause for the presenter. Dr. Archie, I know you deserve a second round of applause. The critical aspects of the details you spilled out has been a success. We say Aiko already. A yeoman's job is done. To the nurses who will be going on the field, kudos to your effort. Until love allowing us to be stand here for everybody.
Thank you very much, Mr. Kabono. Before I invite our keynote speaker, I would like to introduce the Director of Family Health Division, Dr. Marion Okun Owusu. Thank you for coming. So we've come to the highlight of today's program, and now with your help and support, I would like to call on the Director General of the Ghana Service, Dr. Patrick Kumar Aboaje, to formally launch it and give us the keynote address. Please help me welcome him.
Thank you very much, Jacob, and good afternoon. Apologies for keeping you waiting for a delay in the start. Today is the International Day for the Older Person, so we were with them in the University of Ghana, so apologies. And I think it's another important group that we must also focus on. We all get there. We are there. We are nearly there. Thank you. Madam Chair, Director of Public Health, WHO Country Representative, the Director of Family Health Division, and the Acting Director of Health Promotion, our UNICEF rep here, our rep from the Center for Disease Control, members from the LDS Church, that's the Jesus Christ of Latter-day Saints Church, members of the Council of Private Early Childhood Growth and Development, an important group, our esteemed traditional rulers, members of the press, distinguished guests, ladies and gentlemen. Good morning. Once again, I'm especially pleased to be here today as we officially launch the 2024 nationwide integrated measles, rubella, follow-up vaccine, and vitamin A supplementation campaign, which has been described ably by the program manager for API and the deputy director for public health, Dr. Kwame Ponsanchiano. This nationwide effort, running from tomorrow, that's the 2nd of October to the 6th of October, is another crucial step towards protecting the health and future of Ghana's children, and it reflects our commitment to protecting every child from vaccine-preventable diseases. Ladies and gentlemen, Madam Chair, in recent years, our collective public health efforts have brought tremendous gains in reducing child mortality and preventing the spread of infectious diseases. However, measles and rubella remain a significant threat to children under 5, despite being preventable, as was described earlier. Measles, known for its highly contagious nature, can cause severe complications such as pneumonia, blindness, and even death, particularly in the malnourished children. Rubella, on the other hand, though very often mild, can have devastating consequences for pregnant women, leading to miscarriage or severe congenital disabilities in newborns. Our goal with this integrated vaccination campaign is to reach every eligible child in all corners of Ghana to provide them with the necessary immunity to fight against the disease. This year's campaign also includes the administration of vitamin A, which plays a critical role in strengthening the child's immune system, improving their vision, and supporting the healthy growth. Ladies and gentlemen, Ghana has made significant strides in increasing routine immunization coverage, as was said by the rep from WHO, but there remain pockets of under-immunized children, especially in the hard-to-reach areas. Additionally, the global pandemic of COVID-19 disrupted many aspects of our health system, including routine immunization schedules. As a result, we now face the risk of outbreak of some vaccine-preventable diseases, such as measles and rubella, which has re-emerged in parts of the world, including Ghana, where immunization has been challenged. The urgency of this campaign, ladies and gentlemen, is further underscored by the challenges we face in addressing not only measles and rubella, but also improving general child health outcomes. Through this integrated approach, we can amplify the impact of our intervention, ensuring that every child receives comprehensive care. This campaign is a vital tool to ensure no child is left behind. The objective of the 2024 nationwide measles rubella campaign in vitamin A is clear. One, or to begin with, we want to achieve coverage of 95% and above for the measles rubella vaccine. Our target is to vaccinate over 5 million children aged between 9 months and 59 months in all 16 regions of the country. Additionally, we aim to reduce measles and rubella disease burden by ensuring that all eligible children receive this vaccine. We can break the chain of measles rubella transmission and avoid potential outbreaks. Furthermore, we wish to boost vitamin A uptake alongside the vaccinations. We will administer vitamin A supplementation to children aged 9 months to 59 months, enhancing their immunity and preventing vitamin A deficiency-related diseases. Ladies and gentlemen, Madam Chair, we again want to strengthen the routine immunization. This campaign will complement our efforts to strengthen routine immunization system and ensure the sustainable delivery of health services in all of Ghana. Finally, we aim to mobilize communities to support immunization services at all levels to ensure success, and I'm happy that our traditional rulers are with us, and I'm sure they're going to be with us during the campaign as well. This campaign relies on the support of active participation of all sectors of society. Community mobilization is key. We need to encourage our caregivers, community leaders, civil society organizations, religious leaders, and the media to spread the word and encourage participation. Madam Chair, our caregivers, our mothers, our fathers, and guardians of children are our primary partners in this effort. They must be informed and empowered to bring their children to vaccination sites. And we will set up at health facilities, schools, mobile outreach points across the country. And I implore all caregivers to ensure that our children receive these life-saving vaccines and vitamin A supplementation. Your involvement can make a difference between health and death for your children. And I wish to emphasize the vaccines we are administering are safe, highly effective, and free. Measles and rubella vaccines have been used globally and in Ghana for decades, and saving several millions of lives. Likewise, vitamin A supplementation is a proven intervention that reduces mortality in children under 5. We have also ensured that all vaccination teams are trained in infection prevention measures and to maintain the highest safety standard throughout the campaign. Madam Chair, despite the benefits, we are mindful of the challenges ahead. Misinformation about vaccines, logistical constraints in reaching remote areas, and the lingering effort of COVID-19 pandemic continue to pose hurdles. However, we are prepared to address these challenges head-on. Our teams are equipped, our communities are engaged, and our partners are unwavering in their support. We are mobilizing a massive human resource effort for this campaign. Over 10,000 vaccination teams will be deployed across the country to ensure that every eligible child receives both measles, rubella, and then vitamin A. This comprehensive approach will leave no child behind and guarantee the success of our mission to protect the health of our nation's future. Madam Chair, we recognize the critical role of our partners, the World Health Organization, Gavi, UNICEF, CDC, other development partners, the Church of Jesus Christ of Latter-day Saints, the Ministry of Gender and Children and Social Protection, the Ministry of Education, the Ghana Education Service, Council for the Private Early Childhood Growth, Development and partners in providing technical and financial support to make the campaign a reality. Our gratitude also extends to our health workers, our volunteers, our traditional community and religious leaders, civil society, organizations, the media, and all who have worked tirelessly to ensure that we reach every corner of the country. Ladies and gentlemen, in conclusion, I call on every Ghanaian to take part in this important nationwide campaign. Let us come together to protect our children from the preventable diseases. We are all stakeholders in the health and future of our nation, by ensuring that our children are vaccinated and receive vitamin A. We are investing in a healthier and a more prosperous Ghana. On this note, ladies and gentlemen, I declare the nationwide integrated measles, rubella follow-up vaccination and vitamin A supplementation campaign 2024 officially launched. Thank you. God bless our children and God bless Ghana.
God bless our children. God bless Ghana. We need to attend to them without no refusal. You heard the speech. He deserves an applause from everybody. It was resounding. God bless Ghana. God bless you and me.
Thank you very much. Let's put our hands together once again for the Director General. That was the keynote address and formally launching the measles, rubella, and vitamin A vaccination campaign. Please, team, are you ready? So, with the support of our chair and the Director General, as well as our partners who are here, and some of our Queen Mothers, we will do the demonstration of the vaccination at my extreme left side where the nurses are sitting. So please, Chair, DG, partners, please join. Directors who are here, please.
Dr. Achiano, your presentation was super. It's an all-involving detail. Even the summary was reassuring. with the presence of our beautiful queen mothers, we would always appreciate your wealth. Your wealth, your essence is important. You're my one, you're my one, you're my one. Our young nurses in trading, let me assure you, we say, go. Together with your efforts, you will make Mother Ghana proud. Go, it's all I like to say. Let the day roll. With the beginning of this journey is not an easy road. To the representation from the Latter-day Saints, we acknowledge all of you in this hall. Industries, companies, and individuals, mothers and fathers, we say Ayiko. This is a national issue in its direction. Looking at it from all the world, there was a map representation. Do you remember the dark areas are the most prone areas when it came to the details in Ghana? When the facts were well digested, he recalled when he was growing up as a baby. They could have been affected by the situation. This is the end of the stew.
Thank you very much. Thank you. Thank you very much. Thank you, Madam Chair. So as part of communication activities towards this campaign, the service has developed some jingles that are very informative. So we'll plead with you to spend some few minutes with us as we share some of these jingles with you before you leave here. So please let it roll. So they are working on it. Whilst they are working on it, there are also very important information in the form of infographics. If you need information about this campaign and other health interventions, you can go to the Ghana Health Service social media handles, Facebook and the others, and you find them there. They are also displayed here. LinkedIn, we are there. Just go there for other infographics on the measles, rubella, and vitamin A supplementation campaign, as well as other resources. Please, are you ready? Okay. So whilst they are working on it,
To track your son Kumi's growth, to ensure he's developing properly. Then I will take him to the clinic tomorrow.
That is why, for me, after
okay, please try and work on it whilst we take other activities. So we'll give you the opportunity to work on the sound. Thank you so much. So we are gradually coming to the end of the program, and I'll call on our chairperson to formally close us with her closing remarks. Please, let's welcome her with a round of applause.
Wo abofra wedi abosome nkron ekusi ni mfie num so ene emma pane a yede wo mofra na abo won ho ban efri ntobro yare no ho no.
We thank God for how far He has brought us. Director General of Ghana Health Service, Dr. Patrick Kuma Abuaje, our development partners, Dr. Frank John Lully of World Health Organization, directors of the various ministries, departments, and agencies, all religious bodies, our queen mothers, distinguished mothers and babies, and everyone present. First, I will thank Dr. Patrick Kuma Abuaje for launching the measles, rubella, and vitamin A supplementation. Thank you for the assurance that the vaccines are safe. We thank God. We want to hear that, and we've heard that. On behalf of the Ghana Health Service, a huge thank you to all our speakers for their thought-provoking speeches. The statistics shared by Dr. Frank John Lully, as he stated, and I reiterate, that our media should share accurate information with the public. Please, we are pleading, let us disseminate this information in all local dialects. Today, we are here speaking English. I don't know how far this information will get to everyone in the corner. So I'm pleading that as we go out there, the information should also be spread in our local dialect so that everyone will join the campaign. Thank you, Dr. Franklin Asiedu-Bequin, Director of Public Affairs, for the warm welcome. Thank you also, Dr. Amponsa Chiano, Program Director, for the update. I would not try to even the statistics and the information shared and the terminologies I'm not used to, so I would not even try to repeat some of the things said. But then few I can add to what I understood through his presentation, that rubella kills. But fortunately for us, it's preventable, and so it can be prevented. And he also said that 2 ways that rubella spreads, through the mother, from mother to child, and also from droplets, that is in the air. And we know that rubella is endemic in Ghana. And he assured us they are doing all they can to help us eliminate. And this will mean that all of us must support this campaign and make sure that no child is left behind. He tried to explain that the 70 to 100 children that yearly are left behind are creating the cycle, the ripple effect of us having this issue every year. So let us all help to fight this. I know a lot have been said, and I'm repeating some of them. But I take this from Zig Ziglar, who said, repetition is the mother of learning, the father of action, which makes it the architect of achievement. And so whatever I've said, if it's repeated, definitely we'll get to that place where we learn, we take action, and we also achieve. What a day it has been for all of us. We have all witnessed the launch of rubella vaccination and vitamin A supplementation, and I believe we are all ready to push this agenda to the next level, knowing very well that the future of our country is our children, young man, young mofra. Let us all be involved with the dissemination of this information and help all mothers to know the importance of vaccination and the risk they expose their children to if they deny them this opportunity. This nationwide campaign will tremendously improve the quality of life for the Ghanaian child. I thank all our able health workers, knowing the impact of your contribution to our society. We, the educators, would also see to it that we support your effort in every way possible as we strive to serve the Ghanaian child for a promising future. We all know that improved health conditions for the Ghanaian child has a direct impact on their learning experience. Health is wealth, they say. I therefore entreat every parent here to give this campaign their maximum attention and become ambassadors to spread this news to all relatives in every corner of the country. I say thank you all for coming to this program and helping us save the Ghanaian child. Long live our health services. Long live Ghana. Thank you all once again. God bless you.
Please, let's do it better for our chairperson. Thank you very much, Madam Chair, for bringing this program to a successful end. Let's take note of this announcement. When we close, we'll take some group pictures here, just some short group pictures before we leave. We will take, please, are you ready with a, okay, please let it roll.
Do you have a child aged 9 months to under 5 years? Then don't miss the National Immunization Campaign against measles rubella. You don't have to lose your child at this early age. Your child needs to be healthy and strong. From Wednesday 2nd to Sunday 6th October 2024, immunization posts will be set up in all communities, health centers, and hospitals across the country to immunize children from 9 months to 5 years. Take all children aged 9 months to under 5 years to the nearest immunization post to be immunized, irrespective of whether they have received previous measles rubella doses or not. The measles rubella vaccine is safe, effective, and free. A trained health worker will give the injection on the left upper arm. A new needle and syringe will be used for each child. Measles rubella vaccination protects your children from measles rubella infections. In addition to the measles rubella vaccination, children from 9 months to under 5 years will receive vitamin A supplement. Vitamin A protects your children's eyesight and the ability to fight illness. Remember, measles kills. Fully immunized children still need the extra doses for more protection. From 2nd to 6th October 2024, take all children aged 9 months to under 5 years to the nearest immunization post to be immunized. This announcement is by the Ghana Health Service and partners.
Oyabini enanyoji nehu keashi afi enumu. Be kahane boni ababuka ku osege ho ekra. Kahane obi mrebo bemleni edako. She obi ehia gbomocho hewani. Keje show 2nd keashi 6 October 2024. Wabama mo immunization center yewo akochom kehela chamo he feni yo wo manemle. Ni ameba agbubeke bi ni enanyoji nehu keashi afi enumu. Kegbeke feni enanyoji nehu keashi afi enumu. Aya he fe ni ama immunization center ni benkebwe ni agbule. Eko yake agbule osege nchofe komo. Osege nchofa na agbako kra be etuoni ni ahe noko. Many achose ye hela chamo ye baagu gbeke ye enine beku gbeke fe gbeke ake abue he ni baagbule osege to fa abo gbeke bi ahe keje osege hela ahe Nonigbe osege to fan here. Gbeke bi ni enanyodi ne ho ke ashi afi enumo. Abanga amena ke vitamin A supplement ho. Vitamin A supplement ebo gbeke bi aimbe ahi. Ni ewa ke kwon helai ana. Ka mo ake osege gbe omo. Ke gbeke egbu ekomu e ba anya egbu ekom. Koni enna hewale jogban. Keja 2nd October ke ashi 6th October 2024. Ke gbeke fe ni enanyodi ne ho ke ashi afi enumo. Aya immunization center ni benkaboni agbule. Adafi na je Ghana Health Service ka mekpelo ya di.
Wo abofra wedi abosume nkron ekosi ni fie num so ene emma pane a yede wo mofra na bo won ho ban efri ntobro yare no ho no ensan wo eni se wo hwere wo abofra no nemum etwase abofra no nya pomuden mapa enti efri wo kuada 2nd ekosi kosiada 6th October 2024 ya ye besisi immunization centers e won potemu bia apomuden ni ayaresabia bia e wo manyimu ba bia famofra wedi abosume nkron ekosi woni a wo konya mfie num so no nyina ko immunization center be a benwo na won panie no emfa ho se wo ntobro panie no bida ohaw bie ni ho ebu adwuma yi pa na ye free so apomudin adwuma ye ni a ye hyedade na fantitie mu ena de panie no be wo abofra nsa bunkum soro no ye de panie foforo kra ena be wo abofra bia measles rubella vaccination yi bo ba ho ban efri ntobro yare ho emofra edi abosume nkron ekosi mfie num so no ebenya vitamin A supplement ape measles rubella vaccination no so vitamin A bo mofrane ni ho ban na bua mo otumi kuti anyare won so kai se intobrokum intisabo frano wo vaccine no bi da kra na obetumi asan wo na ma wonya ban bo mapa every 2nd kosi 6th October 2024 from mofra wedi abusume nkron ekosi mfie num so no immunization center bi e ben wo na won ko wo bi enkai go free Ghana Health Service ni wa brofo nchei.
Attention parents and caregivers. Did you know that measles and rubella are highly contagious diseases that can be prevented with a simple vaccination, and that vitamin A is essential for your child's growth, immune system, and overall well-being? That is why the Ghana Health Service is organizing a nationwide measles, rubella, and vitamin A campaign from the 2nd to the 6th of October 2024 to protect our children under 5 years old from measles, rubella, and vitamin A deficiency. This is your chance to ensure a healthy start and a brighter future for your little ones. Services provided in the vaccination will include measles rubella vaccination for children between 9 months to 5 years and vitamin A supplementation for children from 9 months to 5 years. The vaccination and the vitamin A will be available at health centers, schools, markets, bar stations, churches, mosques, and within communities across the country. No one should be left out because it is free. So join us in keeping our children safe and healthy. Remember, from October 2nd to 6th, and it is free. Let's bring our children to benefit from the vitamin A and measles rubella campaign for a brighter tomorrow and good life. Live it well. This is brought to you by the Ghana Health Service and its partners.
Thank you very much for that. So I will take the vote of thanks from Mrs. Esther Sarkodie. Please help me welcome her.
I'd like to thank God for giving us sound body and sound minds to be here today. I'd first of all like to thank our chairperson, Mrs. Lydia Ofoswaini Asimeni, for chairing this program. We are really grateful to you. Our heartfelt thanks also goes to Dr. Patrick Abuaje for his inspiring keynote address and for launching this program. Your leadership and commitment continues to guide us as we strive for a better health outcomes for every child in Ghana. Thank you so much, sir. To our partners, Queen Mothers, Women's Group, and our other stakeholders, we are deeply grateful to you for your unwavering support. Your collaboration is crucial to the success of this campaign, and we value your commitment to this program. Our directors from the GHS headquarters, we say thank you for your presence and your support. To our health professionals, the organizers and the volunteers for this program, we thank you for working tirelessly to make sure that this program is a success. God bless you for your hard work. And finally, to our invited guests, our online participants, and to the media, we thank you for joining us today, and we count on your support to spread the word about the life-saving initiative. Together, let's ensure that all children are not left behind. Thank you very much, and God bless you for being here.
Thank you very much, Mrs. Esther Sarkodie, for that vote of thanks. So, Madam Chair spoke about repetition. Let me emphasize on the date again. From 2nd to 6th October, across the nation, which is tomorrow, visit any vaccination center in your community with a child from 9 months to under 5 and get vaccinated. There will also be vitamin A supplementation for the child as well. So let's take note of that. From here, we'll take a group picture after the closing prayer. Office of Chief Imam, Mr. Yusuf, please do us the honors by praying for us, giving us the closing prayer. Please help me welcome him with a round of applause.
Thank you very much. Good afternoon, ladies and gentlemen. Let's bow down and pray. Alhamdulillahi Rabbil Alameen, Ar-Rahman Ar-Rahim, Maliki Yawmiddin, Iyyaka na'budu wa iyyaka nasta'in, Ihdina as-sirata al-mustaqim, sirata alladhina an'amta alayhim, ghayri al-maghdubi alayhim wa lad-dallin. Amen. Thank you.
Thank you very much. So we'll take a very quick group picture. All our dignitaries, invited guests, our queen mothers, please, we'll take a very quick group picture. We know we are behind time, but please forgive us. So all invited.
We got together. Tell me something beautiful.
Our chairperson, queen mothers, our dignitaries, please come and take your seats.
Tell me how your day will be. Would you like to work around it? Everybody would try and try. Keep on moving every day. Down the lane where the nights are gay, where the sun shines, ladies on the mountain top. I took a trip on a sailing ship. When I reached Jamaica, I made a stop. Sad to say I'm on my way. Won't be back for many a day. My head is down, my head is turning around. I have to meet a little girl in Kingston Town.
Please, all partners, kindly join. If you're a partner here, please join. All partners, PAF, UNICEF, CDC, Latter-day Saint, Church of Jesus Christ of Latter-day Saint. Please join, all of you, kindly join. Ghana Coalition of NGOs in Health, please join. Red Cross, please join.
I got her in the rock me. I met her in group lean. She's a rooty baby. You driving me crazy, but today, try to come get away. We need to move this mood.
So after this, take the final one. As many as can join, please join. Students, tutors, nurses who are here. This is symbolic. Please, as many as can join. Please come. We are waiting for you. Quick. Invited guests, women groups. Women groups, please join.
She's a rooty baby. You driving me crazy. You try
You
to
can
try.
sit, partners, you can sit. All women's group, please join.
I got her in rock me, met her in group lean. She tried to make me doing exactly
Thank you very much for
what she
coming.
could
Please
any
remain
day.
seated.
Emmanuel, please come close so we would try. Would you like to grow up and be useful? Make your kids think vitamin A. Everybody talk about vitamin A. When it will go, that's the supplement. Would you like to move it every day? Everybody, oh yeah, that is right. Everybody, don't you never give up. We will succeed at the end of the day. Everybody, would you like to take a step and let us celebrate? Oh, this move every time. Oh, vitamin A supplement. We will succeed in the end. I got her in the rock bean. I met her in group lean. She said,